Hi, this is John Hamilton. I'm the CEO of Liberation Programs, and I'm here today to talk to you about some of the unique challenges that people in recovery face with social isolation. And with social isolation comes disconnection. And there's a famous author called Johann Hari who wrote the book Chasing the Scream. And his most famous quote that I really believe in is that the opposite of addiction is not sobriety, the opposite of addiction is connection. So how do we find connection during these challenging times? And there's some obvious ways that we're using at Liberation Programs to have our recoveries, as we call people in recovery, reach out to their counselors through FaceTime, remotely through Zoom, and through telemedicine to our doctors and medical support. So we're keeping that lifeline for many people open and giving them as much support as they need. For other people that are out in the community and not actively engaged in a treatment program and still in recovery, there's a phenomenal remote 12-step recovery group called In the Rooms that allows people to connect with other people remotely, both in Connecticut and anywhere around the country. So that becomes an option for many people as well. So those are the obvious ways to stay connected and certainly stay connected to family and friends. And it becomes a challenge because for some people, it's the people, places, and things, as they say, that can trigger a relapse. But what we have going on right now is for some people, it's the lack of people, places, and things that can actually lead to a relapse and recovery if it leads to a sense of loneliness, isolation, and despair. So what I want to really point out here, though, is that even though it seems that it's a challenge to make physical connection with social distancing today, I think a key part of recovery is connection to self. There's an author called Gabor Mate, and if people have time to read a great book, it's called In the Realm of Hungry Ghosts. And Gabor Mate believes that the goal of recovery is the ability to be present. And the ability to be present is the ability to be comfortable in your own skin. So this is the key first step in connection, which is connection to self, connection to a sense of acceptance of self, connection with gratitude, connection with humility, understanding your powerlessness, and being able to be grounded in an authentic sense of self. With that authentic sense of self, you have the ability to be able to connect in an authentic way with others. Another connection is a connection to a sense of a higher power, which is something greater than oneself. And at Liberation Programs, we believe in the multiple pathways to recovery. So for some, that can be their faith community. For others, it can be nature. For others, it could probably be today Dr. Fauci, I imagine. For some, it just can't be you. And it's got to be that sense of being able to turn over to believe that there's something greater than oneself during this time that most people are very concerned about, a sense of what's going on in the future. I think people that have a recovery program have the advantage of working, as they say, the serenity prayer, and recognizing what's within their control and power to change, and having the wisdom to know the difference of what they can not change and be able to turn that over and have some sense of hope and faith for the future. So I also want to point out that at our agency, we are not only open for business and extended our hours for outpatient and medication-assisted treatment, we're actually seeing an increase in people coming in because for the first time, there are people in pre-recovery that are contemplating changing their life now that they are grounded and being able to connect to themselves. They may realize that they may have struggled with a substance use disorder and they no longer want to live a dual life. And as they say, you're only as sick as your secrets. And now it gives them the opportunity to ask for help and come in for the first time. So we were actually seeing more admissions than we've seen in a long time. And we welcome people coming in who are new to recovery, and we welcome people who have maybe been in recovery for a long period of time and during this time of transition and crisis may need additional support. So just want to leave with that we are here if you need it. And again, use this time as opportunity to connect to yourself, connect to your family and friends, and connect to something greater than yourself. And wish you health and happiness. Thank you.